The title of this presentation is How do tube diameter and vocal tract configuration affect frequency and amplitude of oral pressure oscillation caused by bubbling during water-resistant therapy? What is water-resistant therapy? It is a voice exercise which includes phonation into a tube which free end is submerged in a recipient filled with water. Several phonatory tasks can be performed such as sustained pitch, accent, glissandos, mesa di voce, song melody, and others. We have two main differences between tubing air and tubing water. The first one is the higher airflow resistance during WRT, and the second one is the water bubbling produce massage-like sensation. Regarding bubbling effect during WRT, bubbles produce a pulsated oral pressure, which frequency is between 15 and 40 Hz, which in turn is supposed to cause movement of laryngeal, pharyngeal, and oral tissues. Generating a massage-like sensation, patients usually report a reduction of sensation of muscle tension and vocal fatigue. Should we control variables that affect bubbling to get a better massage-like effect in patients? There are three main physical characteristics of bubbling: bubbling frequency, amplitude, and regularity. They could impact in oral pressure oscillation, causing changes on massage-like effect felt by patients. In a modeling study by Bisvaga et al., it was found that airflow rate, tube diameter, and vocal tract volume affect physical characteristics of bubbling mentioned before. Authors found that an increased airflow rate produced a higher bubbling frequency, and a larger back volume caused a lower bubble frequency and a greater bubble volume. This back study is the first one exploring the bubbling formation in the context of voice production with tube submerged into water. To the best of our knowledge, today no study has been designed to explore changes in oral pressure oscillation produced by bubbling during different conditions. One important thing is that the present study was performed in humans. The present study aimed at observing the effect of tube diameter and vocal tract configuration on frequency, amplitude, and regularity of vocal pressure oscillation caused by bubbling during WRT. A secondary purpose was to examine the degree of self-perceived sensation of massage-like effect produced by bubbling during WRT. 42 participants were included in the present study. Inclusion criteria included age range from 20 to 55 years, perceptually normal voice, no current or past history of voice disorders, previous experience with tube phonation, and ability to produce different vocal tract configurations. The entire assessment session consists of two different sections: self-assessment of massage-like sensation, meaning vibration produced by water bubbling, and objective assessment of air pressure-related variables. In the first section, participants were instructed to select and produce a sustained bubble-like phonation using a comfortable pitch into three different tubes submerged 5 cm below the water surface. The first one was a 0.5 cm inner diameter tube. The second one was a 1 cm inner diameter tube, and the third one was a 2 cm inner diameter tube. Also, two different vocal tract configurations were produced by all subjects: horizontal position and vertical position. Based on previous data, it was assumed that vertical vocal tract configuration causes an increased total vocal tract volume. Therefore, 6 different combinations were used: 3 tube diameters and 2 vocal tract configurations. Participants were asked to maintain the same pitch during all phonatory tasks. The sequence of tubes and vocal tract configuration was individually randomized for each subject. Participants were asked to assess their massage-like sensation, vibration produced by bubbling, immediately after every phonatory task. Self-assessment was performed using a 100 mm visual analog scale with 0 equal to no massage sensation at all, and 100 equal to very intense massage sensation. Degree of massage-like sensation during bubbling was the only dependent variable in the first section of experimental procedures. In the second section of the experiment, objective measurement of air pressure-related variables were obtained. Participants were required to produce the same phonatory tasks produced in the first experimental section. The free end of tube was submerged 5 cm below the water surface while samples were recorded. Subglottic pressure level was visually controlled by experimenters and participants using a real-time software with a target of 10 to 15 centimeters of water. While phonation into the water, the outer end of the tube was rapidly closed fully with a finger every 1.4 seconds. This shattering produce allows for estimating the subglottic pressure from oral pressure during phonation into the tube. Aerodynamic measures were obtained using a semi-automatic procedure with a custom MATLAB script. Dependent variables from the first section was only degree of massage-like sensation, and dependent variables from the second section were fundamental frequency, oral pressure oscillation frequency, oral pressure oscillation amplitude, oral pressure oscillation jitter, and oral pressure oscillation shimmer. For statistical analysis, we perform one-way repeater measure ANOVAs on each variable comparing the 6 possible combinations of the 2 inspected factors. Generalized eta squared to provide effect size measure. Post hoc contrast by fitting multiple mixed effect models. And post hoc contrast based on the 2 key corrected group. We consider a 0.05 alpha level. Let's see some examples of bubbles from the 3 types of tubes. This is for the small tube, now the medium tube, and finally the large tube. So let's take a look on the results. Regarding oral pressure oscillation frequency, statistical differences were driven by tube size with no effect of tube position. We found that the greater the tube diameter, the lower that oral pressure oscillation frequency. About oral pressure oscillation amplitude, statistical differences were driven by tube size with no effect of tube position. We found that the greater the tube diameter, the greater the oral pressure oscillation amplitude. Regarding oral pressure oscillation jitter, statistical differences were found for the tube size, but no effect for tube position was observed. We found that the greater the tube diameter, the lower the oral pressure oscillation jitter. About oral pressure oscillation shimmer, statistical differences were found for the tube size, but no effect for tube position was observed. Results showed that the greater the tube diameter, the lower that the oral pressure oscillation shimmer. Considering the degree of massage-like sensation, results demonstrated that the vocal tract position does generate differences for medium-sized tube and large-sized tube. However, tube position has no effect when observing small tube. The greater the tube diameter, the greater the massage sensation. Inner diameter of tube and configuration of vocal tract affect bubble characteristics and massage-like sensation during WRT. Larger tube diameters and vocal tract volume seems to produce more regular bubbles, lower bubble frequency, and larger bubble amplitude, causing a more evident massage-like sensation. Therefore, control of this variable is apparently relevant to obtain to the best effect in patients with voice disorders. Thank you very much.